The main reason that I wanted to speak this afternoon in relation to this piece of legislation is in relation to patients with long COVID, many of whom are young with no underlying health conditions, and they are now presenting with prolonged multi-system symptoms which are impacting on their daily lives, affecting their ability to work and causing significant disability for some. And long COVID is having a significant impact on our labour force. And there was an Australian study produced on long COVID which indicates that even low rates of COVID-related permanent illness or disability could lead to significant future societal burden from that particular disease. And Minister, long COVID is costing at least €500 million in lost work and welfare alone. Data from your own department has shown that 0.81% of those who contracted COVID-19 and claimed the enhanced illness benefit payment were medically certified as being unfit for work 12 weeks later. Now, if we extrapolate that across the total number of people infected with COVID-19 in the adult population, that equates to 21,459 adults who are unfit to work or to hold down a job. And if we extrapolate that over a 6-month time frame, that equates to €586 million in lost wages and welfare payments alone. Never mind the impact long COVID is having on our already overburdened health service. And Minister, on a population basis, we're talking about over 21,000 people who may be unfit to work due to long COVID. And that excludes those that have relapsed after the initial recovery from the SARS-CoV-2 infection, or the tens of thousands more experiencing less severe forms of long COVID who have had reduced participation while still in employment. Now, the sad fact for many of these people is trying to get access to care and treatment is nearly impossible. On average, they're waiting 6 months to access long COVID clinics in this country. If they happen to be here in Dublin, it's over 12 months. And at the same time, the Mater Hospital long COVID clinic, which is treating neurological conditions such as brain fog associated with long COVID, is set to close at the end of this year. And this is forcing many patients to travel abroad to access treatment because of the lack of clear referral pathways and treatment pathways in this country. Now, Minister, you'll recall that on the 9th of November, my colleagues and I in the regional group got the unanimous support of this House here for a motion to be passed on the issue of long COVID. Two provisions made in that particular motion that was unanimously adopted here by the House was: one, to ensure that all healthcare and frontline workers who are unfit to work due to long COVID are entitled to special leave with the removal of the arbitrary eligibility date of the 7th of February 2022 for healthcare workers, and further ensure that the current scheme does not abruptly cease on the 23rd or in June of next year. Now, for some bizarre reason, Minister, we within the Health Service, through the Department of Public Expenditure and Reform, has set an arbitrary date that someone within the Health Service had to have contracted COVID at least 84 days prior to the 7th of February of this year and had to be out of work for that period of time to get the extended leave until February or until June of next year. Now, we have actively supported and encouraged frontline healthcare workers to go into work during the depths of this pandemic, at a time when we didn't know what this virus was doing, at a time when we didn't have access to vaccination. And we are now setting arbitrary dates without any justification whatsoever why these dates were being plucked out of the sky. But we have healthcare workers, I know of two in particular, who contracted the virus last January. Young, fit, capable women who are still out of work today, and because of the system that's in place, they are now living on fresh air. because their entitlements have now exhausted. Now, Minister, the key thing in relation to all this, and the reason that I'm bringing it up with you, is that we need to recognise long COVID as an occupational illness for all healthcare and other frontline workers. Now, to do that, Minister, we need you to act under Section 87 of the Social Welfare Consolidation Act of 2005, under the 2007 regulations that were introduced on occupational injuries. And we need you to bring forward an amendment to those particular regulations that allow for long COVID to be considered an occupational injury for frontline workers. And Minister, in those particular regulations, and in under Section 87, subsection 2 of the primary legislation, it states that a condition where there is a risk to a person's occupation that is not common to the population as a whole should be considered under this particular scheme. Now, the reality is that the vast majority of frontline healthcare workers who contracted long COVID did so at a time when there wasn't a vaccine available. But those workers continue to go in during the height of the most recent variants that were available. We spoke earlier on today, Minister, you told me that the substantial amount of the additional €16 million in the Social Insurance Fund was down to the surge in the Omicron variant earlier this year. And during the peak of that, when workers went in at the front line in our health service to treat patients in hospital, ended up contracting COVID-19 themselves, ended up remaining out of work due to long COVID. They are being denied any support whatsoever at this particular point in time, and I'm asking you to change the regulations here to include long COVID as an occupational injury in those circumstances. And it is happening in other countries across Europe. Denmark has brought it in. Israel, Italy, Latvia, Norway and I know Slovenia are doing it at the moment. The European Commission has recognised long COVID as an occupational illness now, and yet we are not prepared to do that here in relation to our own frontline healthcare workers. Now, as I say, the difficulty is that we have healthcare workers now with an arbitrary date who are completely knocked off. And for other frontline workers who are not healthcare workers, they're getting no support whatsoever because they didn't get the extended leave. And you know, I've one particular young healthcare worker who was a clinical specialist physiotherapist within our health service, very young, fit woman, who has since the beginning of this year gone to the private clinic COVID clinic in the Beacon Centre, gone for MRI and ENT appointments privately to Tullamore, has attended the public COVID clinic in Galway, but has also gone to private appointments here in Dublin with Dr. Jack Lambert. At this point in time, that woman has paying €120 per month for essential subline capsule, is paying €65 a month for a multivitamin treatment, is paying €30 a month for a probiotic treatment, is paying €30 a month for melatonin, is paying €25 a month for naltrexone, and the bills go on and on and on. And this is someone that went to work because the government asked them to go to work to provide care for people who were ill in this country within our health service, who went in during surge after surge, wave after wave of COVID-19, and now the state is turning their back on those particular individuals and will turn their back on many more next June. And that's only in relation to the healthcare workers. other frontline workers. And when we had this debate here in the House earlier on this month, and colleagues from all sides of the House came in here and spoke about frontline workers, including teachers who contracted COVID-19 in school, some of them in special schools in this country, providing supports to children with a disability. They are being denied any supports from the state. The state is turning their back on them today. And on top of those public sector workers, Minister, we have at least 4,000 people who 12 weeks after they contracted COVID were still out of work, were medically certified by your own department to be unfitted for work. And, Minister, I believe that they are only the tip of the iceberg in relation to what we're talking about. And we do need to recognise this as an occupational illness, and I hope that you will do that. Minister, in the time that's left, I just want to raise one other issue with you, and that is that we need to take a root and branch overhaul of our tax and welfare system in this country to always ensure that work pays, that it's always better off, and people are always financially better off to be in work than on the live register or claiming welfare. And the systems are built against people. Now, we all know the evidence is there that where people work and are able to actively participate in the labour market, they're financially better off. And we've had the research earlier this year published by the ESRI on the impact of one-parent and family payment reforms on the labour market outcomes from lone parents. And interestingly enough, and I know that there was a lot of criticism at the time when these changes were brought in, back in 2015. But the conclusion of this research from the ESRI is that the reforms led to an increase in the average hours worked by lone parents. The household income increased by between 9 and 12%, and there was an increase of between 23 and 29% in earnings from employment. So clearly there are many incentives there to support people in employment. And one area that hasn't been reformed in years, and that is now a major barrier to people gaining employment, and that is the fact that the medical card income thresholds have not been increased in this country in 17 years. Now, Minister, in that 17-year period, both you and your predecessors have increased the basic rate of social welfare by €71.20, and yet the medical card income thresholds have not increased by 1 cent. In fact, everyone in this country today that is in receipt of social welfare is technically over the income limit for the medical card. However, they're given on a discretionary basis to people who are on social welfare. But if you earn €1 on top of your social welfare, you're automatically denied the medical card. And that is a barrier, a very basic barrier to work, and I would ask you to consider and look at it.